13. We are Group 2, and today we will be discussing Heal New York. My name is Mark Josabello, and I'm here with
Melissa Jose,
Michael Zelaya,
Joe Ranieri,
and Jose Bernal.
So, just a little bit of background about Heal New York, a little history. Back in 2004, New York State passed the Healthcare Efficiency and Affordability Law for New Yorkers Capital Grant Program, which is often referred to as the Heal New York program. One of two primary objectives of the Heal New York program includes implementing a 21st century health information infrastructure to support the delivery of high quality care. The department has supported 4 competitive grant rounds for health IT. The Heal New York Phase 1 Health IT grant awards were announced back on May 24th of 2006 to 26 projects, which was a total of $52.9 million. The Heal New York Phase 5 grant awards were announced on March 28th, 2008 to 19 projects totaling $105.7 million. Heal New York Phases 2 and 4 were not related to Health IT, and Heal New York Phase 3 was withdrawn with funds allocated to Heal 5. The Heal New York Phase 10 Health IT grant awards were announced in September 25th, 2009 to 9 projects totaling $140 million. The Heal New York Phase 17 Health IT grant program was announced on July 12th, 2010 with $140 million in funding available. So I'm going to turn it over to Joe Ranieri, who's actually going to be discussing some of the benefits of the Heal New York program.
Thank you. So Heal New York, the primary goal of it is to change the way we handle healthcare data for patients in a way that allows a patient's healthcare data and their health history to go with them, no matter which healthcare provider or healthcare facility that they frequent. There were over 6 million healthcare visits to hospital emergency rooms in 2015 alone, right? Helping out those patients greatly would be the ability of doctors to be able to look up that patient's healthcare records from their primary care physicians, or should they have visited any urgent care centers or any specialty centers that they visited over time. Right? Many patients visit the emergency room not because of a healthcare reason that came up abruptly, but because something developed over time and then became to the point that the patient needed to see urgent care. Right. So the idea of Heal New York is to bring together this healthcare data through a series of health information exchanges, so that no matter what hospital a patient goes to, the doctor there can log into a centralized database, look up that patient's history, and then determine the appropriate type of care. Obviously, there are many different types of stakeholders for this type of project. You have the healthcare providers that will be helping the patients. Obviously, you have the patients themselves. Health insurance companies and Medicaid that have to pay for these various diagnostics to be done on patients. And then obviously your big regulatory bodies such as the state health department, local health departments, and the health commissioner himself.
Thank you, Joe. We'll be turning over to Melissa now to discuss her part of the Heal New York.
Hi, everybody. Thank you for joining us today. I'm going to be discussing the information systems, particularly SHINY. It's SHIN New York, and the system itself is a statewide health information network. This is something that Joe just spoke about, and this is a way for healthcare professionals to really work together in a secure electronic health information system and organize their patient data. This type of technology is useful for not only the actual medical professionals, but the patients themselves. The importance of this system is to have a secure place where the information is stored. This is a cost-reducing system. So technically, in the past, we've spent a lot of money on transferring case files or information through the mail or having the information transported, but these type of technologies are becoming more secure. They're exchanging information more rapidly, and people are able to access their information more timely. The creation of this type of secure network is not only promoting technical infrastructure, but it sets regulations and it also establishes a network that's governed by healthcare professionals and especially the New York State. The information is flowed through the system and can be actually organized electronically, but it can also be searched based on a particular research that's needed by the healthcare professional. The exchange of information is actually organized and exercised through electronic health records, and this is one of the most important parts about Heal New York. The provider has more access to information and can diagnose the patient's issue quickly. So this is why it is very important, but at the same time, there's scrutiny because Heal New York is exchanging information. This information is a threat, especially when it comes to cybersecurity.
Okay, thank you, Melissa. We're going to turn it over to Jose now, who's going to be talking about RIOs, or Regional Health Information Systems.
Thank you, Mark. So the Regional Health Information Systems is actually something that's under Shiny, like Melissa was talking about. And what they do is it transforms the medical and health technology infrastructure from a paper-based system to a more electronic-based system that allows to address many challenges that New York State faces in its healthcare system. The RIO system helps prevent medical errors, disparities in the quality of care, high costs, administrative inefficiencies, and the increased coordination among physicians. And this is something really important because it tries to minimize these errors and also provide the assurance that the right care is being provided to the patients. And with the RIO in place, it has brought success to the statewide health network, and working under the New York State eHealth Collaborative and with the stakeholder and the constituents, it creates a more effective health information both technically and organizationally through the governmental structure. And RIOs are required to be part of a collaboration that is managed by NYEC that implements and helps to ensure adherence for better guidance. And currently in New York State, there are 9 RIOs statewide, but within those 9 RIOs, there are 4 large ones which include Bronx RIO, Health X, and Interborough, which are the ones that cover mostly New York City. And apart from those state RIOs that place Health X, Bronx, and Health HINIX, and were selected to actually oversee Medicaid claims and be able to process prescription and pharmacy requests that is actually not available through Shiny. And this, like I said, it enables to create a more cost-efficient and effective program to be able to assist those patients and healthcare providers to do their job better.
All right, thank you, Jose. Now I'm going to turn it over to Michael, who will be talking about auditing and the consent behind Heal New York and consent to get from patients.
So what happens when you go to the doctor and you need medical care? Before you actually go in and see the doctor, you'll be required to electronically sign an affirmative consent form that's saved into a database in order to actually give consent to any participants, healthcare practitioners, to view your health information. So what happens when an emergency happens and you're not able to give consent? There's of course an exemption called breaking the glass exemption. Pretty much if you're in an emergency situation where you can't sign consent over, so the health practitioners will are able to view your health information. Breaking the glass exemption would allow them to view your health information. In order for this breaking the glass exemption not to be abused and taken advantage of, because it happens every day. Health information exchange in the database always wants to be taken.
A lot of fraud activity.
A lot of fraud activity. So every breaking the glass exception will be pretty much go through an auditing process to make sure the patient was under a emergency situation where he couldn't give consent to the medical practitioners.
Such as if the patient's unconscious,
Unconscious
or they're just that they're in some kind of mental state where they're unable to give an informed consent to the doctor.
Yes.
Which will happen often.
Yes.
So, all right, thank you, Michael. I'm gonna stick with the consent because that seems to be a fraudulent activity of someone's healthcare information. Definitely something that's happened in the past a lot, and that seems to be an interesting topic to bring up and focus a little bit on here because a lot of times if you have someone who is unconscious and someone who cannot give their information, give voice consent, that could be a serious breach of information without having the proper protocols in place.
Exactly. And it can also be used, let's say, even if there's no patient there, by having breaking the glass access as a medical practitioner, they could easily use that as an excuse to get into somebody's personal health information. So every time it is used, it will be conducted, into an auditing process to avoid the abuse of the healthcare information of patients.
Do you guys think that this contemporary system is a huge step up from what's been done in the past? So for what Jose brought up with the old paper systems and all of this, that kind of...
I can tell you from my personal experience as a healthcare provider working in EMS, it makes a huge difference to be able to move data, patient data, from a paper format to a digital format.
Of course.
It allows you to look at data in a different way, particularly from the so-called 50,000 mile in the air view, looking down and looking at broad spectrums of data.
Right.
A big piece of healthcare is what we call doing quality assurance and research, looking at trends. And in the past, if you had to do that using paper patient care data, someone had to sit there, usually some poor intern, that had to take all that data, compile it, and plug it into a spreadsheet. And then you had to worry about whether or not that person, whoever plugged it in, was interpreting that data appropriately and putting it in the right fields.
Correct.
By moving the data digitally, now that's all been automated for you. You can do some real research and quality assurance on that data and improve care.
Okay. All right, well, that's all for our podcast. We are Group 2. Thank you for listening. Have a good one.
Bye, everyone.
See you guys.